Dr. Bhupesh, once again from Dr. BKM Institutes, doing the third recording of the day for the reading part so that you can listen to these recording 2-3 times. I'm saying you again and again, don't do all the readings when you have exam tomorrow or day after tomorrow. Please listen to 1, 2, or 3 recordings, but listen to them 2-3 times so that what I want to teach you can get into your subconscious mind. Third question we have already done. We have recorded, ma'am. So you can take it from there. We will send you the recording. It's a very simple question. In this statement, they wanted to ask you what is false. All the statements are true. Only one is false. So it was saying all of the following are true except. So they were saying the number of patients are increasing. And in this particular paragraph, it is never saying whether the patients are decreasing or increasing. If anything is increasing or decreasing, I need two datas that I will say in 1997, the patients were 200. In 2000, the patients are 300. But it is never saying the patients are increasing or decreasing. So obviously, A option is the false option. And if I talk about B and C, the trial organizers are not yet ready. Yes, they will have enough data to access the treatment reliably and not before time. This and can better be replaced by but. So they will have enough data, but not before time. That means they are not ready. They will never be ready. And since the beginning of the trial, almost 9,000, yes, so far nearly 9,000 patients have been randomized. So B and C were correct. We had to do the false option. That is what we said. This was very easy question, but somehow we got tricked. And now I am going to question number 6. Let's see question number 6. If surrogate mothers are implanted, this is where active passive are so important. I am telling you again and again. If surrogate mothers are implanted means this is a passive voice. Passive voice means anything that says B plus third form is a passive voice. B plus third form means B first form is MR, B second form was were, B third form been. If any of these ever comes with the third form, that means it is a passive voice. Passive voice means the work is being done by someone. ये काम किसी के द्वारा हो रहा है. If surrogate mothers are implanted by the scientist, by the doctors, so this is a passive voice. If surrogate mothers are implanted with embryos which have previously been split, the pregnancy rate is. So if surrogate mothers are implanted with embryos which have already been split, means the embryos which have already been split, what will happen? The pregnancy rate will increase or decrease. Once the sex of the embryo is determined, it can be split to produce twin embryo. Means if there are embryo and the sex is determined, that these generally, sorry, I'm breaking off the momentum, really sorry, but this is what I want to teach you primarily. Active passive. This is also a passive voice. Have been split. Split first form is split. Split second form is split. Split third form is split. So that is where it tricks you. Been के साथ third form. I just told you any form of B is MR, was were, and been or B. So been is also part. So that means if surrogate mothers are implanted with embryo which have previously been split, the pregnancy rate is. So this is also passive. One of the once the sex once means when the sex of the embryo is determined again by the doctor, it is a passive voice. Is plus third form again is plus third form. Once the sex of embryo is determined by the doctor, it can be split again a passive voice. It can be split by the doctors to produce twin embryo. These can then be transferred. Again, it is a passive voice B plus third form. These can then be transferred by the doctors into the separate surrogate mothers or frozen for the future use. That means the embryos once divided, they can be either stored by freezing it or can be put into separate surrogate mother. The researchers believe that this is the first time that embryos have been frozen before an analyst has sexed them. So before the determination of sex, this is the first time that embryos are being frozen. Again, passive voice. The team reports pregnancy rates of between 60 and 65% of whole embryos and 55 to 60% for the those which have been split. Now this is the trick. This line is little difficult. The team reports pregnancy rates of 60 to 65%, means pregnancy rate is, the chances of success is 60 to 65% for the whole embryos. And for the split embryos, it is 55 to 60%. That means if you will understand this calculation, that if the embryo is whole, then the chances of success is 60 to 65. And if it is a split one, then chances decreases by 5%, because it decreases by 5%. The margin is 5%. So that was my question, which previously have been split. The pregnancy rate is a little lower than a little lower. Yes, it is lower, 5% lower. So I think the answer should be A. It's very simple, yeah. It is trying to trick you. That is where you are getting tricked. A little higher, no. Split is having less. It is not higher. 60% lower, no, it is not 60% lower. It is just 5% lower. It is just 5% lower, and that is a little lower. So that is, again, it tricks you just by figures and you get tricked. That is why I say, please do these easy questions right. You will definitely pass in OET exam. Leave the difficult questions for the second round. Always try to find 10 to 12 easy questions out of 22 in part B and C. First of all, in first 20 minutes, complete 10 to 12 questions with complete accuracy in 20 to 25 minutes. You will always pass OET reading exam. You will never fail. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. And please listen to this recording 2 times, because I know it is very easy, but it will take into your subconscious mind also that readings are very easy. They just try to play a little bit of trick. But if you will listen to it once, you will understand this thing. It is easy, but you will not realize it. I want you to realize this, that OET reading is definitely easy. You just have to find 10 to 12 easy questions. Thank you.